New England Cancer Specialists is a private medical oncology practice that services the needs of patients in Southern Maine. We have a dedicated team of physician, secretary, nurse practitioner, and primary nurse, and medical assistant that all work to navigate the patient through the system and to take care of their needs on a daily basis.
When you call in, you're going to get the same people and don't have to explain your situation over and over again.
My job is to help the patients scheduling appointments, their scans, referrals if they need to be referred to another office for whatever reason, just coordinating all of those things together for them. And just also, offering compassion, reassurance, it's a whole package deal, I think, with our whole team.
I'm a patient's resource from start to finish. So from the beginning of the journey, I help you set up your plan, guide you through it, guide you through symptoms, difficult times, and then even after the treatment phase, I'm still your first line of defense if you have any concerns or questions or are worried about things changing. We also help navigate them to their survivorship care plan.
We have now very good data to show that patients who have a cancer diagnosis are often under great financial distress. So we here at New England Cancer Specialists, we have financial planners that help patients understand what's the impact. They help patients to tap into resources that are available to them. They help patients in the whole negotiation piece with the insurance. As a matter of fact, we do that for patients for that very reason. And all of those things, I think, help patients to have the security in a very unsecure time in their life.
When a new patient is diagnosed with a cancer diagnosis or a blood disorder, as a financial advocate, we meet with that patient first off to help them understand the cost, what they would be facing for even office visits, for labs, for the cost of chemotherapy even, understanding their benefits. The benefits they can be very complicated and patients don't understand all the different terms, and we go through that with them. We go through that very thoroughly with them to make them understand. And we reach out to any local organizations, even national organizations, to help get funding to offset those out-of-pocket costs for these patients.
We're available when the patient needs help the most, not when it's convenient for the doctor.
We have our doors open now 7 days a week. A lot of times what had to happen in the past is that when patients had, say, a side effect from a treatment or had a particular concern or had a fever and needed to be seen, the only option that we had really was to send the patient to the emergency room.
We have an urgent care system, so every call that comes into the office with, I have a sore throat, I have pain, my leg is swollen, my head feels funny, goes through a set triage pathway, and patients are brought in the day that they make that phone call to be seen either by their doctor or the nurse practitioner to address any urgent concerns they might have, as opposed to sending them to an emergency room where it would be a different doctor, every shift who really wouldn't have any knowledge about that person.
We have a lab on site here at New England Cancer Specialists because it is so important for us for a patient to have this one-stop shopping that we call it.
Diagnostic x-rays, testing.
Scans if there's something urgent. We can oftentimes get those done the same day.
We also have a physician dispensing program. And what that means is that patients who are eligible can have their oral prescriptions filled on site. So we have a dedicated system with a full-time pharmacist who helps educate the patient, helps the patient obtain their medications, make sure they take their therapies the way they should, and to really have that follow-up with the patient that we do via phone call 2 or 3 days after their therapy, especially with oral prescriptions. And our treatment room nurses are always in constant touch with our patients after their first therapy and subsequent therapies. So it's really that tight integrated care model that we have that really results in a better patient outcome and a better patient experience.